Lower facelift tends to be associated with the surgical space. We now have many more materials and procedures, techniques that we can use to implement a non-surgical facelift. What we're doing is we're trying to influence two procedures in the lower face. One is volume loss and migration, so we tend to see from the age of 30 onwards that fat will move. It will also lose its volume. The third thing that happens is that the muscles in the lower face become hyperactive, and when depressors of the face become hyperactive, we also need to weaken those strategically to allow the elevators to lift the face. So by combining those two procedures, we tend to get really excellent outcomes and surpass the expectations of our patients.
I had started having the treatments in the first place when I was 29 because I could see that my face was beginning to age and I wanted to keep on top of it.
The most crucial thing about getting a good result is to map their face in detail. We're looking in particular at where there are pockets of volume loss, where volume has come from and where it's going. Then we put the volume back into those spaces, and as I mentioned before, we also try and weaken the facial depressors to allow the elevators of the face to kick in and therefore generate a lifting effect.
You do look better, and people say to me, they say, you know, you look really well, you look well, and that's what you want, isn't it? Don't necessarily want to look younger, but I just want to look well for my age.
So if you're interested in having a non-surgical lower facelift, then of course the best thing to do is to come along and see us at Cheshire Cosmetic or here at my practice, and I'll give you a free consultation and give you a wonderful result.